Hi everyone, my name is Mel and I'm going to be giving you an introduction to hypertension and our project. Before we get started, there's a short pre-survey about hypertension we were hoping you would take part in before proceeding, and the link is on here, and you can also scan the code with your phone camera if that's easier. To give you a little bit of an introduction and purpose behind our presentation, we want to start off by explaining the project. As second-year medical students, we were tasked with coming up with an intervention design meant to better the Detroit community. This intervention is supposed to address and attempt to alleviate health concerns or risk factors faced within the community, while also taking into account the efficacy and sustainability of our solution. The project we took on is focused on the management of hypertension in older adults. We thought this was an important concern to address because hypertension is a major risk factor for heart disease and stroke, and it's actually the leading cause of death for heart disease and the fifth leading cause of death for stroke. So since high blood pressure is a risk factor for these detrimental health problems, it's an ideal target for prevention and control strategies. Hypertension is also highly prevalent in the population, and especially here in Detroit, where 60% of the population is at risk for having it. Further, it is a common condition that will catch up to most people who live into an older age, and there's a CDC study that shows the prevalence increasing to up to 75% among adults who are 75 and above. So it's a very important concern that we feel needs to be mitigated. For our plan, we hope to educate older adults on the importance of hypertension management, the risk factors associated with it, and the health impacts it could have. We also want to provide information about possible lifestyle modifications that could be useful in managing high blood pressure, as well as healthcare interventions such as medications that may be useful. Secondly, we would like to provide blood pressure monitors. One of the reasons this is important is because hypertension can be a silent killer, since a person may not have outward or explicit symptoms for years, leaving it to quietly damage the heart, vessels, brain, and kidneys if left untreated. Thus, having a personal blood pressure monitor would make it easier for people to be able to regularly check their blood pressure. And even for those who already know they have hypertension or know they're at risk, having a personal monitor can help with staying on track and making sure that it's being well managed. And a third reason is that checking blood pressure at home typically gives a more accurate reading because people tend to be more calm in their homes instead of feeling anxious or stressed out in a clinical environment. Ultimately, we just generally believe it's important for people to get in the habit of checking their blood pressure for the sake of their health. Next, we wanted to give a few helpful definitions before we really delve into our presentation. And to start off, we have blood pressure. If you have a blood vessel and blood is flowing through it, blood pressure would be the force placed on the walls of the vessel by the blood. Blood pressure is typically broken down into systolic and diastolic pressure. In the blood pressure monitor picture that's shown at the top, systolic would be 115, diastolic is 63. And their definitions are dependent on the heart's action. When the heart beats, it contracts to push the blood out and then relaxes. Systolic pressure takes place when the heart is squeezing the blood out. Diastolic is when the heart is relaxing and filling up for the next round. This is why systolic is usually higher than diastolic, because when the heart is pushing blood out, the pressure against the blood vessel walls is going to be higher than when it's relaxing. Hypertension, also known as high blood pressure, occurs when the pressure inside the vessels is too high. And when it's too high, this increases the work the heart has to do, which can damage the heart, the blood vessels, and the organs that depend on those vessels. Lastly, the chart on here shows how blood pressure can be broken down into 5 categories. A normal blood pressure is when the systolic is below 120 and the diastolic is below 80. A person's blood pressure is considered elevated when the systolic is between 120 and 129, the diastolic is less than 80. For hypertension stage 1, the systolic would be between 130 and 139, or the diastolic would be between 80 and 89. A person has stage 2 hypertension when their systolic is 140 or higher, or their diastolic is 90 or higher. A hypertensive crisis is when systolic is higher than 180 and or the diastolic becomes higher than 120. And this is a dire situation because it can lead to a hypertensive emergency and end organ damage. Thank you for watching this video, and lastly, there is a post survey we were hoping you would participate in, and like before, the link is on here, as well as the code that can be scanned. Thanks again.